Good afternoon and welcome to our webinar series. The Lifestyle Medicine Program at the Mass General Cancer Center is thrilled to host this six-part virtual webinar series where we will explore strategies to improve health and well-being. We are thrilled that you're joining us today. Some of you may ask, what is lifestyle medicine? The Lifestyle Medicine Program at the Mass General Cancer Center provides evidence-based lifestyle interventions that can improve quality of life, alleviate symptoms post-treatment, and promote the adoption of healthy lifestyle behaviors after a diagnosis of cancer. Our program provides personalized consultations as well as group visits for patients who receive their care at the Mass General Cancer Center. At the conclusion of today's webinar, focused on strategies to improve bone health, there will be an opportunity for discussion and Q&A, so feel free to type your questions in the Q&A box at the bottom of the screen. It is now my pleasure to introduce our speakers. First, I will introduce Loren Winters. Loren is an advanced practice nurse at the MGH Cancer Center at Waltham. She is the Assistant Director of the Lifestyle Medicine Program, and she sees patients who are referred for individual lifestyle medicine consultations. In addition, along with Carol Sullivan, they run the group visit program for the Lifestyle Medicine Clinic. In addition, Loren is currently involved in exciting research that will be using principles of a lifestyle medicine group visit for individuals with a diagnosis of advanced breast cancer. Carol Sullivan has been at the Mass General Cancer Center for more than 15 years, and she helped launch the lifestyle medicine individual and group visits along with a lifestyle medicine team in 2020. Carol is passionate about supporting her patients and loved ones throughout their cancer journey, where nutrition priorities are often changing and evolving. Finally, Dr. Mitra McLarney is a physical medicine and rehabilitation physician with specialized training in cancer rehabilitation and pain management. She collaborates closely with patients throughout their cancer journey and how to reach their functional goals and enhance their quality of life. I will now turn it over to this incredible team. We will talk about strategies to build bone health.
Thanks so much, Amy. Again, I'm Loren, and I'm happy to be here talking to all of you today. And I think I'll just jump right in. So the title of our talk today is Steps to Build Bone Health. And just to make it light, I wanted to start with a fun quote. Reba McEntire, who many of you probably know, a famous singer, musician, said at one time or another, to succeed in life, you need three things: a wishbone, a backbone, and a funny bone. I love that because we're talking about bones today. So just to give you a little sense of where we're going with our conversation, be talking about just very briefly the anatomy of bone and just naturally what happens to bones over time. We'll also be talking about these particular conditions, because they're certainly relevant in the setting of cancer treatment. What is osteopenia, osteoporosis, and how common is it? The risk factors for these conditions, and then how we screen. And then Dr. McLarney will be talking about what exercises are best for bone health. So it's great to have the information, but what do you do with it? She'll be talking about that. Also providing exercise safety tips. And then finally, Carol Sullivan, our dietitian expert, will be talking about what foods and nutrients are recommended for optimizing bone health. And I'm really excited for that. So just a little quick trivia, a fun little question. True or false, is bone an organ? The answer is true. So bone is considered a structural organ that develops through the actions of specialized cells in our bodies. These are called chondrocytes and osteoblasts, so they have kind of cool names. Osteoblasts have a role in synthesizing bone matrix, and they become sort of entombed within the matrix of the bone to become osteocytes. And these cells act as little sensors for gravitational forces, so that's like us moving up and down, as well as mediators for communication between cells that essentially have this role in remodeling bone. The bone is actually dynamic. It's constantly changing, constantly undergoing this remodeling process. And then there's these other cells called osteoclasts in addition to the osteoblasts and the osteocytes, and they serve as sort of secretion. They have a role in secretion, and they put out sort of proteins or enzymes that are responsible for ultimately the resorption of bone. So a disruption in any of these processes can lead to essentially a decrease in the integrity of the bone structure. So that's what we'll be talking a bit more about today. So here's just some pictures of what I was just talking about, the osteoclasts and their role in resorption of bone, and then osteoblasts, you can see there, and then this idea of the chondrocyte and sort of all of the parts and pieces of that. So it's just sort of fun and interesting to know how it's all happening. It's happening all the time, even right now. So some more fun facts about our bones. Did you know, my kids always say, did you know, there are 206 bones in the human skeleton, and they're composed of, different types of bones. So there's cortical and trabecular bone. Cortical bone is the dense solid, and the lines outside of the bone. Trabecular bone is our spongy bone. It's more honeycomb-like. And all of these, again, all these aspects of our bone are sort of make up the bone structure. So this is also neat, what are the parts and pieces? So the cortical bone makes up about 80%, trabecular bone makes up about 20%. Peak bone mass, so sort of when our bones are at their strongest, their most dense, is actually fairly early on in life, in our late teens and early 20s, maybe. I've also read close to 30, but it unfortunately does tend to decline after that. So while we are still undergoing this remodeling process throughout life, again, just by way of reaching a peak and then slowly losing that over time, we do see that bone does get weak over the decades of life, but also can be influenced by some of the things we're about to talk about. And so that brings us to, versus normal skeletal health, to some conditions that can impact skeletal health. And these are osteopenia and osteoporosis. And it can be important to sort of understand the difference between those two, even though they're related. So it essentially means that there's the bones are porous. So we already said that bones already have a porosity, right? Especially the spongy type, but it's a degree beyond, or some degrees beyond, what's considered normal. You can see these two pictures. One side, normal bone, yes, it's got some Swiss cheese-like holes, but then the difference with an osteoporotic bone, the holes are quite larger. You can see that the bone doesn't look as thick or strong, and so it's very clear, it's very visible what the difference is between these two bone structures. And so that ultimately results in a decrease of strength of the bone, and therefore increased bone fragility, meaning more subject to a fracture or a break. So how common is it? Unfortunately, it's very, very common. 54 million Americans have osteopenia or osteoporosis. And then for the age group of 50 and older, the prevalence, again, is very high. So about 43%. And that's sort of average, men and women. In women, if you're comparing women to men, women have an even higher incidence. And then a prevalence of osteoporosis is about 12.6. Again, that's higher in women, and particularly in adults over the age of 65. So the estimated likelihood of an osteoporotic bone fracture over one's lifetime in the setting of osteopenia osteoporosis is 1 in 2 in women and 1 in 4 in men. So what are some causes of bone loss? The list is actually quite long, and I had to work to kind of make it a bit more digestible. So it kind of came down to these categories. But certainly smoking, which is a modifiable risk factor that we want to make sure we put, first and foremost, a very good reason to quit smoking is that it can impact your bone health, amongst many other reasons. Excessive alcohol use, again, another modifiable risk factor. Family history, not so modifiable, right? Our genes are our genes. So that one we can't unfortunately change. Nutritional problems, here's another one, certainly modifiable. And, there are certain circumstances where that can be very challenging, but again, if that is an issue, that's certainly something that could be addressed and sometimes would require the help of one of our dietitian experts. Lack of physical activity, being more sedentary than active time during the day. While that might not be an issue for a short period of time, if that were to be prolonged, that could certainly impact the bone density, further weakening a bone structure, sort of as we talked about before, how important that gravitational forces are on bone remodeling. So if that's not happening, then the bones aren't getting that feedback that they need to build. Certain health problems. And so this is where the list gets really quite long. And I'm not going to list it all, but I will highlight that, cancer and certain treatments for breast and cancer and certain treatments for certain types of cancers can put people at a particularly high risk for loss of bone density. There are also certain chemotherapy drugs, use of steroids over longer periods of time can put the bones at risk. Certain plans of radiation, depending on where that's happening. And then, of course, as a result of fatigue or pain or other sequelae of cancer treatment, the lack of physical activity if that's prolonged. So again, I promised I wouldn't list the longer list of causes, but that we did want to mention cancer. And then finally, medications, I did touch on the fact that there are certain cancer treatments that can increase the risk, but there are also a host of other medications that can impact bone and bone density. So how do we go looking for this, and kind of when do we go looking for it? We'll also talk about that. But the bone mineral density scanning is how we do it. It's called a DEXA scan, which stands for dual X-ray absorptiometry. So try saying that 10 times fast. What it does is it measures the energy of X-ray beams passing through bones. Kind of cool. The more dense the bones are, the less energy is detected on the other side. Simple. So the X-ray energy is detected and is converted into a value of measurement. In most of the reports we see, it's in grams per centimeter. And they look at typically the upper femur bones, that's the upper thigh bone, the lower spine, and sometimes will include the forearm. The values and the measurements are compared to that peak, sort of the average peak bone mass. Again, we talked about sort of someone in their 20s having sort of the average peak. And so they take essentially that amount of density and compare it to yours when you go through the scanner and come up with this T-score, which is the bone mass related to that peak. And then another score called the Z-score, which is only done later in life, that compares that bone mass related to your peers, essentially in age. So that's the bone density. And in women, when the bone density sort of spits out its report, osteoporosis is diagnosed if the T-score is a score of negative 2.5 or lower. So that's in the negative numbers if you remember your high school math. All right, so who should be screened? In general, age of 65 and older, possibly earlier for those with risk factors. So again, if you're on a medication that you're taking for a long period of time, that may be a very good reason to screen earlier. And that may be the case in many cancer patients. Menopausal women should be screened who are usually around that age or getting close to 60 or 65. We talked about medications that may increase the risk, suffer a fragility fracture or a compression fracture. If one hasn't been screened and that happens, it absolutely should be part of the workup. And then certain medical conditions that could change hormone levels. So, aside from cancer, there are many other medical conditions that can do that, and that would be a consideration for screening. So treatment options are part of our conversation today, but we're mainly going to be focusing on the healthy lifestyle aspects, not as much about medications, but of course, when there is osteopenia or osteoporosis and continued risk, medications are considered and often recommended for treating. But along with lifestyle modifications, because we know that the combination of the two is more effective than just the medications by themselves. So we're going to be talking to you today about what type of diet can help optimize bone health, what types of minerals and vitamins are important, what type of exercise. Of course, we had talked about the other two already as being modifiable risk factors, quitting smoking, decreasing alcohol, because those can further deplete our bones. And then, like I said, we're going to kind of move past medications. So I'm going to be passing the conversation over to Dr. McLarney at this time. Thank you so much.
Awesome. Thank you so much, Lauren. So I'm going to start with our trivia question for this section. So true or false, exercise can help to maintain bone density and slow bone loss? So that's true. Yeah. The exercise is really important, as we'll kind of dive into in the next couple of slides. But it's a great way to maintain your bone density, slow bone loss, improve muscle strength, improve just functionality in general, and also just to kind of reduce pain as well too. So exercise has a lot of benefits, and so it's definitely something to try to incorporate. Next slide, please. So before we get into the recommendations for exercise in osteoporosis, I did want to just highlight the exercise recommendations for all cancer survivors that's been put out by the American College of Sports Medicine. And so ideally, we would love to have individuals working towards a goal of 150 minutes of moderate exercise, which could include some brisk walking, light swimming, those sort of activities, or 75 minutes of vigorous exercise. So that's when we're putting a little bit more effort into the exercise and maybe putting a little more stress on our joints with some jogging and running each week. In addition, we also like to recommend some strength-based work as well too. And so ideally 2 times per week, doing some strength training of the major muscle groups. So thinking kind of about your arms, your legs, shoulders, core, that sort of thing. And then also some daily stretching. So that's the ideal of what we would hope to try to recommend for all cancer survivors. And then we'll on the next slide kind of look into the difference for patients with osteoporosis. Thanks. So a lot of these similar principles are also in the recommendations for exercise in individuals with osteoporosis or at risk for osteoporosis. And I know this table might be on the left, might be a little small, but we're going to dive into each of these recommendations and types of training a little bit further in the next coming slides. We'll say there's 4 different types of exercise focuses that we have for individuals with osteoporosis or at risk of osteoporosis. And that includes balance training, strength training, aerobic exercise. So a lot of similar things to what we were seeing for the just general recommendations for cancer survivors. And then also there's an area kind of focused on spinal extensor training. So those are the muscles that kind of keep our posture up. And so we'll talk a little bit about that as well too. I also put on this right side of the screen, the perceived exertion scale. And that's a scale that's really something that you can use, on your day-to-day as you're doing different activities and different exercises to kind of gauge how much effort you're putting into the activity that you're doing. So it's a scale that goes from 0 to 10. And when we're thinking about exercise, we're really hoping for reaching that range between 5 to 8. So that's here listed as hard to very hard, which is probably a little difficult to understand exactly what that means. But what we're thinking about is activities that are maybe somewhat hard for you to do, but you feel reasonably comfortable doing them, versus all the way up to activities that may feel like a little bit more effort, but you're still able to do those activities. You might just have to push yourself a little bit harder. That's kind of on that higher range. So next slide, please. So when we are looking at first the balance training, like we mentioned at the very beginning, so balance training would be something that we would ideally like to have individuals do every day. I know it can be a little daunting to have too many tasks at once, but that would be the ideal. And it would be to look for 15 to 20 minutes per day to work on this. And what we would be focusing on is really trying to address alignment and also preventing fall risks is the biggest part of balance training. So this graphic is really just to show what a balance program might look like, at least initially. So, if you were starting out, focus would be really on kind of keeping your feet together, standing. And as we gradually moved forward, starting to kind of shift your feet so you're a little bit off of full support, just right beneath your body. So having a little bit of a semi-tandem stand versus then moving and progressing to a tandem stand. And then ideally getting to a point where you're doing a one-legged stand. This is something, we would also say as we would progress, sometimes we would start to, have people close their eyes and do different other additional things to test their balance. But this is just an example of some of what a progressive balance training program could look like. Next slide, please. Strength-based exercises, like we said, are also very important. So this is very similar to what the American College of Sports Medicine suggests for cancer survivors. And we're looking at 2 days per week, ideally, where you're doing 8 to 12 repetitions for each of the exercises, focusing on major muscle groups. So your legs, your arms, shoulders, chest, back, that sort of thing. We initially would have, you work with your own body weight before we start adding additional weights to things. So the 2 pictures were actually provided by one of our physical therapists here, but they show just exercises that you could do with your own body weight. So not needing any additional equipment outside of I guess on the left, a chair to assist with that chair touch squat. And so the squat with a chair touch, you would be doing to kind of work on strengthening that lower body, versus a wall push-up, which is on the right side of the screen, kind of demonstrated to try to work on strengthening the upper body. Like you'll kind of really appreciate as we're talking further about like spinal extensor training, alignment and proper positioning is the most important thing when we're doing these exercises. So making sure that we're keeping our spine straight and not putting undue force on the spine is always really important when we're doing these things. Next slide, please. So spinal extensor training, this is something that doesn't necessarily need to be a huge time commitment, but is really beneficial. The spinal extensors, like I said, are the muscles that kind of help with our posture, kind of help us support the spine, and are definitely activities that we could add in, 5 to 10 second holds, 3 to 5 second rest in between each of those holds for 3 to 5 sessions a day. And so what's depicted kind of on that left side of the screen is an individual kind of lying on the ground, flat surface, nothing underneath the neck or the back. So everything's kind of level with their knees bent, and they're just pushing their shoulders back into the ground and using the force of the ground to push back a little bit. And then a more advanced exercise would be what you kind of can see on the right side of the screen, where an individual's keeping their lower body flat on the ground and then gradually lifting up their upper body. But as you can see, it's really important that spine remains neutral. So, and we're not seeing any excess curvature in that spine when we're doing these exercises. Next slide, please. And then just touching on examples of aerobic-based exercises. So similar also to, what we talked about with the American College of Sports Medicine recommendations for cancer survivors. With individuals that have no history of fractures, the recommendation is to do 150 minutes of moderate to vigorous intensity activity per week. So very similar recommendation. If you have a history of fractures, that recommendation tends to be more focused on those moderate intensity activities. So more walking, elliptical sort of work, versus necessarily running or jogging and those sort of things that put more force on the body. 150 minutes can be a lot to take in when you're thinking 30 minutes a day and finding that window for 30 minutes a day. So we often say 10-minute chunks is great and perfect if you can fit that in. So 10 minutes, 3 times a day, whenever is convenient for you, is a great way to incorporate some of these exercise into your daily regimen. And like, I alluded to, we're talking about more weight bearing exercises for your aerobic based exercises. So that is kind of walking, elliptical work, or like this little clip art picture shows kind of a person running up the stairs or something like that. So those would be good examples of weight bearing activities that you could do. Next slide, please. So this is a question that often comes up, can I play sports if I have osteoporosis, or I'm at risk of osteoporosis? And like you'll find throughout this discussion, everything's very dependent on the individual. We can't necessarily give a blanket statement for everybody that this would be the safe thing to do. But so if you have any questions, as we'll talk about too, feel free to reach out to a provider and kind of get that assurance moving forward. When we think about sports, it really does depend on previous participation. So if you had already been doing a lot of these activities, it's different than if you were to be picking up these sports later on. Not to say that you can't, it just changes kind of our risk profile as we're thinking about moving forward. Some of the sports, like if you're a big golfer or tennis player, you may need to make some modifications to how you're doing those sports. So maybe a little bit of a modified swing to kind of avoid putting too much force into the spine area. And then some of the other activities that are more high risk for falling, so mountain biking or skiing and those sort of things, are things that we would have to be cautious about and may need to avoid depending on the severity of the osteoporosis that you have. But those are things to kind of think about. I guess the biggest point I wanted to kind of highlight with this is that it's not to say that you can't play sports or things that you love because you have a history of osteoporosis. It's just maybe we need to make some modifications or think about how to do it safely to make sure that you're able to participate safely with those sports. Next slide, please. So just to kind of touch briefly, although we've kind of looked at these before, but just some of the safety considerations. So we want to take precautions when we're doing excessive twisting, bending forward or bending backwards with the spine if you're at risk of osteoporosis or have osteoporosis. In addition, it's always important to think about sites that have had previous bone fractures as places that may be more likely to fracture again, as the bones may not be full of the full strength of the other bones that are in your body. I always say too, to think about pain as a great internal metric. So if you're doing an activity and you start to feel an increase in pain, that's a good indication that you need to kind of pull back a little bit and maybe seek some additional discussion with providers or additional information before moving forward with those sort of activities. And then if you are at high risk of falls, or if you're having some difficulties with gait or balance, those are things to also keep in mind when we're thinking about safety. Next slide, please. So this kind of goes right into when to seek medical advice. So if you are wanting to just be screened for activity, you would like to just have a conversation about what your risk factors are and thinking about how to start activity back up safely, that's a great reason, and definitely come see a medical provider for that. If you have any questions about supplements or medications, which we're going to briefly talk on some supplements, but medications and things like that, we're not really getting into in this presentation. So that's always a great option too, to seek medical advice. If you have any questions about when and how to incorporate exercise safely, if you've had any history of fractures, or if you have any medical conditions or other medications that may not be directly related, but may affect how you participate in activity, those are always great reasons to seek medical advice. And ultimately, if you just want to talk to someone, and get some comfort, that's always a great reason as well too. And the next slide, please. Oh, and then I think that's it for me. And I'm going to pass it on to Carol.
Hello. We're going to switch gears a little bit and talk about.
Hang on one second.
Oh, sure.
Guys, it wasn't the last slide.
Oh.
That was my bad. There is a really important slide that I want to make sure we share. So Mitra, go for it.
Thanks. So I just wanted to put a little plug in for the cancer rehab clinic here at MGH in Spalding. We are lucky that we have this opportunity to have this clinic here, where we have basically physicians like myself who are subspecialize in physical medicine, rehabilitation, and also have an interest in cancer, that, are here to kind of help with thinking about diagnosis and treatment of any physical, psychological, or cognitive impairments that you may have related to your cancer, and how we can kind of use what we know to optimize function and quality of life. So if, like we said, if you have any questions about returning to an exercise program, interventions, if you have some pre-existing impairments that you want to kind of see if there are interventions that we can use to address that. And we also just work closely with the therapy team here at MGH in Spalding, which is phenomenal. And we have over 30 physical therapists and occupational therapists that are specialized in oncology related rehab, and love seeing our patients. So if you are interested in connecting with one of us, there's currently 2 providers here at MGB in Spalding, but if you're interested in connecting with us, can ask for a referral or call our office, and we'd be happy to see you. Okay, now I think next slide.
Yes.
I'll let it over to Carol.
Thanks, Mitra. All right,
Thanks.
Carol, sorry for the interruption, but
No worries. I was caught off guard. Like, what happened? Okay. Thank you, Loren, and thank you, Mitra. So we are going to switch gears and talk a little bit about nutrition for bone health, which is another modifiable factor when it comes to keeping our bones strong, despite, I think, probably a large portion of us on this webinar being above the age of 30 and past our peak bone mass. So you can go to the next slide, Lauren. So just as a little bit of an agenda, we're going to talk about broadly the nutrients of importance when it comes to bone health, and then specifically talk about calcium, vitamin D, and a little bit on vitamin K and K2. Next slide. And my trivia question is, true or false? The only important nutrients when it comes to bone health are calcium and vitamin D. These are certainly the ones that get the most attention, that have the most research behind them. But you go to the next slide, Lauren. There are many nutrients that are really important for bone health, which really just speaks to the importance of a varied diet, since we really require a lot of different vitamins, minerals, and adequate protein to support really good bone health. One of the reasons that undernutrition and malnutrition are a risk factor for poor bone health, because if you're not getting enough of these nutrients over a prolonged period of time, that can put you at risk for bone health as well. So moving on to the next slide, we are going to talk about calcium to start, where calcium, just to define what the RDA is, the recommended dietary allowance is the average daily level of intake of something that is sufficient to meet the nutrient requirements for nearly all healthy individuals. So when we think about calcium on average, we're thinking about getting 1,000 milligrams of calcium a day, so 1,000 to 1,200. So 1,000 for women 19 to 50 years old, 1,000 for men 51 to 70 years old, 1,200 for women 51 to 70 years old, and then greater than 70 years old, we're looking at 1,200 milligrams. So 1,000 to 1,200 in general. So when you go to the next slide, we are then thinking about where are our calcium sources coming from, and there are dairy sources that we're going to talk about on this slide, and then we'll talk about some of the non-dairy sources on the next slide, where if you look at the very top food, just to highlight, in all dairy products there is some calcium, starting with ice cream at the very top, and then if you work your way down, cottage cheese has about 100. Cheese in general for 1 ounce, which is a slice or a 1 ounce cube, is about 200 milligrams of calcium. Milk is about 300 per cup. Kefir, which is a fermented yogurt drink, has about 300 per cup. And then the same thing with yogurt that might be a little bit cut off on this slide, is about 300 to 400 milligrams per cup. But at the MGH Cancer Center, we really are encouraging a plant-based, plant-predominant diet. So if we think about, can you still meet your calcium requirements with a plant-based diet? You can. So if we go to the next slide, you can see a list of the plant foods that are really high in calcium, with the lower amounts starting at the top, where broccoli has about 60 milligrams, and that second food that has an asterisk, the almonds, provides about 75 milligrams. That asterisk that is in this list does indicate that these foods have a high amount of what's called phytic acid that decreases absorption of calcium. So it doesn't mean that it's still not a good food to include in your diet, because so many of these plant foods also have many of the other vitamins and minerals that are really important for bone health. It's just to help you understand that you're not going to necessarily absorb all of that calcium that is in that food. And it gets a little bit unclear when we're talking about, well, what percentage of that 75 milligrams of calcium in almonds am I absorbing? It's going to be different person to person. Your circulating vitamin D also plays a role in how much calcium that you're absorbing in your gut. So we can't say specifically, Loren, when you eat 1 ounce of almonds, you're only absorbing 40 milligrams. It's just not that exact of a thing. So really just highlight and let you know that the foods that have the asterisks you're not perfectly going to absorb that much of the calcium. So if we go to the next slide, I really like this slide that I made that demonstrates 1,200 milligrams of plant-based calcium in a day, roughly, which I did include 2 high phytic acid foods on here with the almond butter and the almonds. But just to show you, if you added up all of these foods for the day, a cup of soy milk, which if you're buying plant-based milks, you can actually check the label to make sure they're fortified with calcium. Some plant milks are actually fortifying with also vitamin D and B12, which I think is fantastic. So a cup of soy milk would give you 300 milligrams. Add a little bit of almond butter, drizzle on your oatmeal or yogurt and fruit in the morning. That would give you another 100. If you use 2 tablespoons of tahini in a salad dressing or a sauce, and then you added it to a salad or cooked kale, even a salad with kale or cooked kale, that would give you another 100 milligrams for a cup of raw kale. And then a snack in the afternoon of figs and almonds could bring you up to another 160. And then at dinner time, if you had some cooked spinach or collard greens, you'd get another roughly 100. And then white beans would give you a little bit more, with a half cup giving you another 100. So it's definitely possible, but it takes a lot of intention to get up to that 1,200, which is really when supplementation comes into consideration. Most 90% of people that I see, if we take a look at their calcium intake for the day, it usually averages like 300 to 400 to 500 milligrams for the day. So a lot of times supplement is recommended, which we're going to talk about as well. So usually if you're getting 500-ish milligrams in your diet, and we say take a 500 milligram calcium supplement, usually say avoid taking any more than 500 milligrams of calcium at one time, because that's all you can absorb at once. If you're somebody that isn't really eating any foods that have calcium, and you're taking 2 calcium supplements that are about 500 or 600 milligrams of calcium, we always recommend that you split them up to have the best chance of absorption. And then taking greater than 1,000 milligrams per day through supplements can increase the risk of kidney stones. So we never recommend more than 1,000 or 1,200 milligrams through supplements. Calcium supplements can cause side effects like gas and bloating and constipation, especially with if you have a history of irritable bowel syndrome. Calcium citrate is less likely to cause these symptoms. And if you're taking calcium carbonate, then you need to take it with food to increase the absorption of the calcium in this form. And this is necessary when you're taking calcium citrate. And then finally, research does show some risk of heart-related issues with calcium supplementation that's greater than 1,000 milligrams a day. So another reason that we don't tend to recommend more than 1,000 to 1,200 milligrams of calcium supplements per day. With the bottom line being really to get enough calcium to meet your needs and not more through and supplements. Next slide, Lauren. And moving on to vitamin D is really crucial for not only the absorption of calcium, but for muscular strength too. So as we get older, if we are vitamin D deficient and we have less muscle mass, making sure that we have enough circulating vitamin D might help keep our muscles strong. So twofold importance for vitamin D, especially as we get older. The prevalence of vitamin D deficiency in the US is about 42% of adults, and that risk increases with darker skin. When you have darker skin, this requires longer sun exposure to actually produce the amount of vitamin D that we would need to have in our blood for adequate levels. So in the US, 63% of Hispanic adults and 82% of African American adults are actually vitamin D deficient. So if you do have darker skin, even more reason to ask to get your vitamin D levels checked. And there are 3 ways to get adequate vitamin D. The first is sunlight. However, you need 10% of your body exposed per day to maintain normal levels of vitamin D. So living in New England, working inside, this generally doesn't happen, and the prevalence of vitamin D deficiency is higher the higher longitude that you go, right? No, latitude, right? That you go up Earth. So then we tend to default to supplements because you also don't get much from food, which is going to be on the next slide, but the supplement recommendation really does vary depending on your blood level. And this is when you would want to get the recommendation from your medical provider on how much vitamin D you should be taking. But generally, the minimum is around 800 international units, up to 2,000 international units a day for like a maintenance dose of vitamin D. And then if you have a history of deficiency, there are or if you are deficient, there are multiple ways that of dosing to bring your vitamin D levels back up to that normal par. So this is definitely a good one to ask about getting tested. And then the foods are pretty sparse that can keep your vitamin D levels up. They tend to be cod liver oil. Not a lot of people are taking cod liver oil by the tablespoon these days. It isn't actually recommended because cod liver oil can also put you at risk for too much vitamin A and vitamin A toxicity. This is something that people are really doing anymore. The reason people are usually taking fish oil anyway is to get the omega-3s, which now come in supplements that are a lot more tolerable than taking a tablespoon of fish oil. Anyway, the other sources that you might get might be things like trout, salmon that has bones in it, and then mushrooms that specifically have been exposed to UV light, which can be hard to find. Not many stores carry these. And then dairy does have some vitamin D in it as well. So again, we're usually not getting enough in our food. So it's definitely one to request to get tested, especially when it comes to healthy bones. Next slide. So just for your knowledge, if your vitamin D level is less than 25, that's considered deficient. 25 to 50 is inadequate for some people, and then greater than 50 is sufficient for almost the whole population. And this comes from a review from the Scientific Advisory Committee on Nutrition and in combination with the Institute of Medicine. So again, this is a good one to have extra help determining your blood levels and supplementation. Next slide. The next nutrient of importance that's been studied a little bit more recently is vitamin K1 and K2. So you can think of vitamin K actually as a grouping of vitamins similar to the B vitamins. We have B vitamins and then multiple different subclasses of B vitamins. The same thing with vitamin K. Vitamin K is important for blood clotting. Vitamin K2 tends to be a little bit more important for calcium metabolism and possibly bone density and strength. The RDA, recommended daily allowance for vitamin K1, is 120 micrograms, which most Americans tend to get in their diet. K2 is the one that sometimes people don't get enough of in their diet, and it is found in animal food and fermented foods and also produced by our gut bacteria. So far, research on K2 specifically is really mixed, whether supplementation is helpful, and there isn't a recommended daily allowance for K2 so far. And average intakes appear adequate for most adults so far, but there is currently research being done on K2 to see if that would be helpful for more of the population and maybe more people who are at risk for osteopenia and osteoporosis. Another shout out for a more plant-based diet, right? If our gut bacteria is producing more K2, if we're eating a diet that is high in fiber, that includes a lot of plant foods, you can probably assume that we are producing more K2. So another reason for those plant foods. Next slide. That's it from me.
Thanks, Carol. So just to sum it all up, lifestyle medicine may help to protect your bones after cancer treatment. Ask your team about your risks for your own bone health related to your treatments and your cancer. And remember that exercise may help to build bone and lower the rate of bone loss. So it's always important to be as active as you can be. And then lastly, the health of our bones really do rely on proper nutrition and a steady stream of nutrients. Thank you, Carol, for going through the research with us. We do have some resources listed here. This is sort of public available resources that will have, I think, excellent information. In fact, many of the tidbits that we shared with you today are from these resources: American Society of Clinical Oncology, cancer.net, American Institute of Cancer Research, the AICR. This is affiliated with the World Health Organization. And then the Bone Health and Osteoporosis Foundation has a lot of good specifics. I will add that the MGH Cancer Center Nutrition Group has put together a really fantastic table, pieces of which you saw today, that lists the food sources, including the nice list of plant-based calcium-rich food sources. So that maybe is something we could send to participants. This is available, to sort of broadly available, but I'm not sure it's easy to find on the Cancer Center website. So perhaps we can get that list, which has those tables, out to participants of this webinar. That's all we have for slides. So I will stop our share. I think there are some questions.
Questions coming in. You all covered this topic so beautifully, but there's a lot of questions, of course. So one of the main questions is, will we get the slides? And so this is being recorded, and we will plan to get this webinar onto YouTube so you can watch it as many times as you want. And certainly we will share some resources in a follow-up email as well, as Loren just noted. So I'm going to try to go through some of the questions, maybe real quick. I'm going to start with Loren first because she has expertise in this area. Does half an hour of yoga a day cover balance training?
That's great. So if I remember, Mitra will have to help me out. It was 15 to 20 minutes is where one would start with balance exercises a day, and then work your way up to somewhere around an hour. Is that right? That's sort of like the min and the max, I think, that you shared with us earlier. So of course, yoga is quite variable. There's so many kinds of yoga, different ways to do it. There's some practices where one might remain sitting in a chair the entire time, chair yoga. And then there's others that, one is sort of doing all kinds of balance activities. So I think it would depend on the type of yoga, that you're working on. But certainly if you were doing a yoga practice that did involve standing in different positions for, X number of breaths, usually it's anywhere from, 3 to 10 breaths, depending on the instruction and the type of yoga. And you were doing that, enough of that to get up to about 15 minutes. I mean, that's certainly a great start. I know my traditional practice, there's lying down, there's standing up, then you're lying down again. So you probably do get at least, 30 minutes in an hour-long practice where you're working on balance. But again, it would all depend. I would personally endorse it very strongly. And on our lifestyle medicine website, we do have an exercise videos tab, which we shared a yoga practice that includes mostly standing postures. So if that's something you're even interested in playing with, we were happy to put that together. And that's about maybe a 15-minute class. So that's on our lifestyle medicine website. Mitra, would you add anything or?
No, just to say yoga, Tai Chi are great options for balance.
Yeah, Qigong, Tai Chi. Yeah, fantastic. That's great to add those two out there too. And I know my mom loves Qigong so much. She does that every day.
Mitra, there's a question for you. You showed the benefits of doing wall push-ups. Are there specific modifications you would recommend for a patient who has lymphedema, who's perhaps concerned about this participant said folding her hand at the wrist and concerned about aggravating the lymphedema?
Absolutely. I think that that's a very astute point. And I would recommend there's other ways that we can work on our upper body strengthening without necessarily putting force through the arms like that and putting your wrists into that level of flexion. So I would, there are definitely modifications and other things that could be done. And I think your lymphedema therapist would probably be a good person to connect with about that. If you're seeing them regularly, they should be able to give you some ideas of exercises that can work on your upper body kind of strengthening without having to do a wall push-up. But I agree, it wouldn't be a great idea to do that regularly if you have lymphedema.
Thank you. Carol, there's many questions about vitamin D, so I'm just going to summarize a few of them. Is there an upper limit to how much vitamin D an individual should take? And if so, what potential side effects could happen? And then secondly, is there a multivitamin that you recommend that cancer patients take?
Yeah, I don't have a specific multivitamin off the top of my head that I'm comfortable talking about to the masses. That's something that, again, is usually pretty individualized. The options that are out there, if you're going to take any vitamin or supplement, just make sure it's third-party tested. I forgot to mention that as we were going along. So you can see either an NSF certified stamp or USP for US Pharmacopoeia stamp and the bottle. And then in terms of the upper limit for vitamin D is considered 4,000 international units. There are providers out there that recommend up to like 10,000 international units a day, which is totally unnecessary every day and long term. So 4,000 is considered by NIH to be the upper limit for vitamin D.
Thank you. Mitra, there's an interesting question. What do you think about using a weighted vest when you're walking? Is it helpful or not really necessary?
So weighted vests are great and fine, but I would not suggest going right to a weighted vest immediately. Making sure that you're able to do walking exercises and not exacerbate pain or anything like that before you add a weighted vest. But I don't have any problems with a weighted vest if it's done, as long as you're doing it appropriately and not overdoing it with the amount of weight that you're putting on your spine initially.
Thank you. Loren, question for you about bone density tests. This participant's wondering, when we get a bone density, do the results and measurements kind of factor in an individual size? This person's wondering, given her petite or smaller bone structure, is that taken into account?
Sorry about that. I don't believe that the results of a bone density study would be significantly different in a petite body versus an average size. But there are some aspects of one's anatomy, or even prior health conditions or even surgeries, for example, that may make doing the standard sites of spine and hip a bit challenging, in which case the radiologist or endocrinologist who's interpreting the study may request that the forearm. So I mentioned before that the forearm is sometimes included. In some facilities, it's always done. At MGH, they don't include it unless they don't feel they can get a good picture based on what they're seeing in this using the standard 2 sites. So they might add on the forearm as an additional site to measure to provide that bone density data back to the provider. So it's a great question. There's some subtleties involved. I think it would be more of an individualized answer, but it is a great question. I don't know, Amy, if you have anything to add on that for Mitra.
No, I mean, Mitra, you go ahead.
No, I don't have much to add to Amy or Loren.
Thanks. Yeah. But it's always worth talking to your own healthcare providers to ask if there's any concern about you having the test or anything you need to be thinking about. Usually it's helpful to go ahead and you have your first baseline study, and then that information is sort of clarified once you have the test.
That's great. Thank you so much, Loren. Carol, I'm sure you get this question all the time. I certainly do as well. Is collagen helpful, but this person specifically wondering for bone health?
It might be like there's been a few animal studies and a couple studies, small studies in postmenopausal women that show collagen might help with bone mineral density over 3 or 4 years. But that's, I guess, up to you if you want to commit to buying a collagen supplement that isn't very inexpensive and take it every single day. And I think the amount used in research is around 5 grams or so per day. But I think there's more good research behind the calcium and vitamin D being more helpful. So making sure that you're adequate in those 2 vitamins and minerals would be even more important first.
Great, thank you. I know there are so many questions and I feel badly we can't get to all of them, but I just want to give our speakers one last minute. They want to give one last bullet point, focus on their part of the talk to just kind of drill in. And Loren, since you went first, why don't you give one key bullet point? We'll go around the screen and make sure we share resources after this webinar today.
Yeah, thank you. Well, I think my take home is more a reflection on my co-facilitators. Really, I think the take home is that using healthy lifestyle behaviors can be so impactful, and that I feel so strongly that should be more of the part of the conversation with our healthcare teams. So if it's not coming up in your visits, please bring it to the visits. Talk about what you are doing, and create an opportunity for a conversation with your providers to pick their brain on what more you could be doing if you are looking to optimize. Perhaps you are doing all you can do, but it's just worth having that conversation. And then also knowing that there's these fantastic resources available if there are specific concerns, like our registered dietitians and like Dr. McLarney, who is a phenomenal physiatrist, and we're so lucky to have her here for folks who need help getting back to exercise, getting back to function after cancer treatment, which can really impact that in a great way. So it was really just a reflection on the great work the great folks that we have here.
Thank you, Mitra.
Yeah, I would just say that exercise is a great thing to add in for so many health benefits outside of just osteoporosis. I know that was the focus of our topic today, but it really has numerous benefits. And it can be a little daunting to think I need to try to get 150 minutes in or, just looking to that level immediately. So just recognizing where you are and starting out slow and at a low frequency is fine. It's really just getting yourself excited to do it and kind of out there. There's, those numbers are kind of recommendations, but everyone's different. And so, make sure you kind of modify it to what makes sense to you and your lifestyle. And feel free to reach out to any of your providers if you have questions about it, if your specific situation. Just going back to that weighted vest, if you have any questions about that specifically, if you have certain risks, definitely make sure you talk to your provider about it.
Thank you, Mitra. And Carol, last but not least.
Yeah, I think nutrition can be so individualized, and there's so much misinformation out there, and it can be really hard to navigate the whole picture of oncology and nutrition. So our dietitians are available to meet with you with questions. I'm also open to answering further questions as well. So I don't know if I have one more bullet. I think everything that I said was really the most important highlights when it comes to bone health.
Thank you so much. Thanks to all of you. What a great informative webinar. We're getting lots of good feedback in the comments. So this is being recorded and will be shared soon, and we will send a recap message. So thank you all for joining us today. And we hope you join us again for our next webinar, which will be held on May 15th, which will focus on lifestyle medicine strategies to address anxiety after a diagnosis of cancer. Thank you.